morning, everyone. I'm Dr. Tejal Soni, consultant gynecologist and obstetrician at Apollo Spectra Hospital, Tardeo. So, today I would like to speak to you about a few important gynecological problems that women face in day to day lives. Normally, women are very busy with their lives and they don't take proper care of themselves, and these small gynec problems they tend to overlook. They are very busy with their professional life, family life, and busy with their children. But these are the small gynec problems, and some are important ones which they need to speak to their doctors. So, the first problem I need to speak about is the menstrual disorders. So, normal menstrual cycle normally lasts from around, women get bleeding for 2 to 7 days, and normally they soak from about 3 to 4 pads a day. If there is any variation in this, then they need to see their doctor. If you get bleeding less than 2 days, if there is any scanty bleeding, if you get just spotting for less than 1 day or something, and you just get a brownish discharge or something, then it's better to show your gynec and to find out what is causing all this. Or on the opposite end, if you get very heavy bleeding more than 7 days, or bleeding for 7 days only, but you're passing a lot of clots, you need to change pads every 2 hours. If you just get up and there is suddenly a rush of blood and you need to change your pads, there is anemia, then that is also an indication to show your gynec. So, this is the duration of the menses. The second point I would like to talk about is that a normal menstrual cycle lasts for 28 to 30 days. And a normal variation is from 21 to 35 days. So, if you all have your periods occurring less than 21 days, like every 10 days or 15 days, then that is an area of concern. That is also a time you need to get investigated and you need to show your gynec that why this is occurring, why you're getting your periods every 10 days, every 15 days. Another point is if you're getting your periods late, after 35 days, once in 1.5 months, once in 2 months, then also you need to show your gynec. Another important thing you should keep in mind is you should check for any intermenstrual bleeding or spotting. That is, you're getting normal periods. Your periods you're getting every month for 3 to 5 days. But between your periods, sometimes you get some spotting, some brownish discharge, or some bright red discharge that might occur more than once, or it occurs at between every period. So that is one of the time then you should show your gynec. The reason for this could be either cervical polyp or endometrial polyp, or it could be chronic cervicitis. Also, another important point is that you should check for post-coital bleeding. Means you're having intercourse, and after intercourse also you're bleeding every time. So that is also an area for concern, and you should show your gynec regarding the same. So, as you know, these are all small problems that women face in their daily lives. But these are important problems which the cause of which could be something major. So you need to show your gynec regarding the same. Another important problem women come with is discharge PB. So this is a very tricky situation, as you all should understand that 50% of the time the women experience normal physiological discharge. So like between your periods, normally you get sticky jelly-like discharge for 3 to 4 days. So that is normal. Every vagina requires some form of lubrication. So there is discharge in a normal vagina. So that is normal. But when is it abnormal? When there is any foul smell, when there is any colored discharge, when there is any white, thick discharge, curd-like or paneer-like, then you should be worried. If you're getting itching in the private parts, or when there is burning over there, so then it's better to show someone and find out why you're getting all the discharges. So, most common vaginal infections are caused by fungal infections. Those are candidiasis. So in candidiasis, there are like this thick white discharge from the vagina, and it causes a lot of irritation and burning. So you have to show that. For that, your doctor will give you any antifungal treatment, either orally or vaginal pessary, and you have to follow that for around 5 to 7 days. Another vaginal infection that can occur is bacterial vaginosis, gonorrhea, chlamydia, and for each of them, there are different symptoms. Like you can get a greenish yellow discharge, so that is a totally different chlamydia infection, and for that you need another type of antibiotics but not antifungal. So for the diagnosis of the vaginal infection, you need to show your Gynec, who will examine you from internally and check the type of discharge you're getting and accordingly treat you. Also, another good point is increase your intake of probiotics, like a lot of dahi, chas, or any oral probiotic tablets now are available. So they help you with the increase of the good vaginal bacteria, and they fight off the fungal and other bad bacteria in the vagina. Also, since Mumbai is a very hot and humid city, it is also advisable to wear cotton underwears and not synthetic and latex and the newer ones that which are not absorbable, means they don't absorb your sweat. So you need to wear cotton underwears that absorb your sweat, and it will help you in keeping your private parts healthy. And wear breathable underwears. Also, if possible, wear cotton pads and not the synthetic ones, because they also cause a lot of rashes in the private parts. One more thing I've seen very common in women is they do waxing of the private part, which is very harmful because it strips off the protective layer of skin. So it's better to shave or clip the hair of the private parts. There is also a newer trend of using V-wash and I won't say V-wash specifically, but a lot of intimate washes. And these also I've seen cause a lot of allergy in women and young girls actually. So it's best to wash your private area with warm water, not with soap, not with any washes, plain warm water. That is enough to clean your vagina and external vulva. But you should clean it every time you take a bath with warm water only. Talking about vaginal discharge, another related topic that I see very commonly is urinary tract infections. These are very, very common, especially in young girls who have been just sexually active. It is very common after the first sexual exposure. In this, typically the symptoms are you get burning urination, means you get burning micturition, means whenever you pee, it burns. You get pain in the lower abdomen. You get frequent micturition, means even if you passed urine, you feel like passing urine again and again. And urinary tract infection in general is a very irritating disease because people cannot bear the pain of the infection. And in some very severe form of urine infection, you might even get fever and might require admission and IV antibiotics also. So, in general, urine infection can be easily treated by over-the-counter antibiotics that your Gynec or doctors will prescribe to you. A few hygiene tips that you need to keep in mind are keep yourself hydrated, wash yourself and pass urine after every sexual intercourse. Whenever you use a public toilet or something, just wash yourself and keep yourself clean. And try to use cotton underwears, which I advise a lot because the synthetic underwears have been a major cause of all the infections in the vaginal and private parts. Also, some form of exercise daily. If you're studying or working, then you can go for a quick walk, 30 to 40 minutes daily, or you can join a gym or some class which you enjoy, like Zumba or something. Then that, and healthy diet, like just include 2 fruits and 2 vegetables daily. And most important, please include protein in your diet. Most of the Indians are protein deficient. That is why they lose muscle and they don't have good nutrition, because they are protein deficient. So have good protein in your diet. So that will improve your overall health and will improve your immune system, and thus will prevent the various vaginal and urinary tract infections. Talking about pain, there is another pain that we women have to face in our daily lives is the pain during periods. So normal pain during periods every woman faces during the first or second day of the period, but any pain that exceeds this and it disrupts your normal life, that you have to stop your daily activities, you cannot continue your daily life, you need to take painkillers daily. So that such a pain is an alarming factor, and you need to show your gynec regarding this. So the reasons for this could either be endometriosis, fibroids, and ovarian cyst, or pelvic inflammatory disease, or it could be a multiple, or it could be many other factors which your gynec can detect after various investigations. So don't take your period pain lightly and think that every woman faces this in their daily lives, and this is a part and parcel of life. So if you're facing such severe pain during your periods, don't take it as a part and parcel of life and bear it. It's better to show your gynec and to find out what is the cause of it, because there could be some important reason that is causing the pain. Now let's talk about our breast. As you all know that the female breast have a very important use, that is for feeding the babies. Also, you all know that some women face breast tenderness and pain before periods. So that is normal. This normally occurs 2 to 3 days before your period starts, and this is a normal occurrence. But you should keep a check on your breast if there is any severe tenderness, or if there is any discharge from your nipples, or you feel any lump or anything, then please show someone. Every day while taking a bath, you should palpate your breast, both the breast, and just feel for any lumps, because as women we need to take care of ourselves. Another important topic is there is an increased rate of cervical cancer all over the world, and India is the second country which has the highest number of cervical cancer cases. But as you all know that cervical cancer vaccines have been launched in India and all over the world, which are routinely given to all girls and boys between the age of 11 to 12 years. The cervical cancer is normally caused by the HPV virus. So, to prevent this viral infection, the vaccine has been made. Till now, Gardasil vaccine is available in the market, and below 15 years, 2 doses are given to the girls and boys, and above 15 years, 3 doses are given. But very soon, our very own Serum Institute of India is going to launch the HPV vaccine, which is going to be quite affordable and easily available. So all you mothers over there listening, please vaccinate your girls by the time they reach 11 to 12 years, and even the boys should be vaccinated. This vaccine can be taken up to 40 years of age, but it is most effective if it is taken before the first sexual exposure. So it is most effective in the young girls and young boys. These vaccines are easily available at all gynecological clinics. So please give your children the vaccines. Another important topic that my patients come to me with is that they finish their family and they want some the various form of contraception, but they are not ready for the surgery, the tubectomy. So then normally I advise them either oral contraceptive pills, which are the 21 days pills that you're supposed to take every month. So these offer 99% protection against pregnancy. Those are one of the options. Second option is copper T, which is a very safe option, which has a very good success rate. These can be put either for 3 years or 5 years, and the newer ones are there which can be put for 7 years also. So you can use them also. Then there are those medicated copper Ts like Mirena, which release progesterone, and they have two uses. So if you're having either menorrhagia, very severe periods, painful periods, so you can insert Mirena. They will stop your bleeding, they will decrease your painful periods, plus they'll give you protection from pregnancy. So these are a few options. There are many other options. You can take depot, like monthly injectable injections which will protect you from pregnancy. There are 3 monthly injections. Then there are the Implanon that you can just implant in your body, hand or somewhere, that will protect you from pregnancy. So these are the latest ones. You can try them if you want for a longer period and you don't want to take daily tablets and everything. So you can just take the injections for 3 months. Every 3 months you can just repeat the injections. They will also help you from pregnancy. Also, it is not advisable to use IPIL very frequently. If sometimes if you have unprotected intercourse once in 4-5 months, then you can use it. But it does not give 100% protection. I've seen many patients who come with me in spite of taking IPIL, they become pregnant. So it's better to have another first line of contraception that you use daily. You cannot just solely depend on IPIL for contraception. Now we'll get to the question answer. Some of the most common questions that my patients ask are that do all fibroids need surgery? So the answer is no, not all fibroids need surgery. Only if your fibroids are symptomatic. If you are having heavy periods, menorrhagia, severe pain during periods, then your fibroids need to be removed. Also, the size and the position of the fibroids matter, whether they need to be removed. Sometimes the fibroids are big, like of medium size, 4 to 5 centimeters, but they do not cause any side effects. They do not cause any heavy periods. They do not cause any bleeding. They do not cause any pain. So they don't need to be removed. And if, especially if you're of the menopausal age where your periods are going to go, then please don't remove them, because after your menopause, the fibroid sizes shrink. So don't remove them. Also, if the fibroids are near the endometrial lining, and even if they are small, that is less than 3 centimeters, they can cause very severe bleeding. They can cause menorrhagia. They can cause passage of clots. They can cause very severe pain. So such fibroids, even though they are small in size, need to be removed. So we have to make a decision based on individual cases whether the fibroids need to be removed or not. There are also various ways to remove fibroid. You can either remove them laparoscopically or by open myomectomy, that is open your abdomen and just remove the fibroids. So you can, that your doctor will take a call, like which is the best approach for you. Another question I am very often asked is that we are trying to conceive, so should we visit a Gynec or should we try on our own? So it is always better to visit a Gynec before you try to conceive. It is known as pre-conceptional counseling. Your Gynec will counsel you regarding which is the best time to try to conceive in a month, which are your fertile days, which are your infertile days, when will you ovulate. So all this your Gynec will advise you. Also the Gynec will give you some supplements like folic acid, which you need to start ideally 2 months before you start planning. And the Gynec will also run a few tests depending on your age and the other factors, whether you smoke or you have alcohol and or your past history. So the Gynec will advise you regarding the same. Another question I'm asked is about regarding abortions. Like many young couples, they are not ready for kids and they come for abortion. So which is the safest way for abortion? So you should understand that there are 2 methods of how we can go forward with abortion. And one is the medical abortion, where the doctor gives you the pills and you can take the pills orally, and after 2 or 3 days, whenever the pills are over, you will start bleeding and it will be like a heavy period. So this occurs only within the first 7 weeks. After first 7 weeks, you cannot do the medical abortion, that is abortion via the tablets. After 7 weeks, you can do a procedure which is known as dilatation and evacuation, which is done ideally in a operation theatre under anesthesia. So that is after 7 weeks of pregnancy. And in India, abortion is allowed up to 20 weeks of pregnancy. So you should take a call as if you are mentally, financially, and physically prepared for a new baby. Also, people ask how to keep. People normally keep on getting repeated vaginal infections, urinary tract infections. So, how to keep all this at bay? So, for that, you need to first of all keep your body healthy, have healthy food, keep yourself hydrated, keep your private parts clean, wash them daily with warm water. Don't use synthetic soaps or anything. Don't use them in the private part because it is the most cleanest part of your body. And while after you pass urine, always clean from the front to back, means from the vagina to the anus. Never clean from the anus to vagina because that anal part is the most dirtiest part of the body. So it should always be, you should always clean from the front to back. Second part is, as you all know, the vagina has a lot of bacteria, its own vaginal flora. So there are good bacteria and bad bacteria. So when the level of the bad bacteria come up, then that is the time you get the repeated vaginal infection. So to maintain the good bacteria level, you need to have good probiotics. As I said earlier, more of dahi and chas and natural probiotics. Those you can use. Also wear breathable clothes in this warm, humid weather. Wear loose pants. Don't wear synthetic clothes. Don't wear latex, rubber, leather pants and all those for long period of time. Of course, if you need to wear, you will wear, but don't wear for long period of time. Those shapewear, underwears and all those, they also cause a lot of vaginal infection. Always go for trimming your private part hair instead of waxing. Waxing is very bad, which may cause the hair follicle infections, and you should keep a watch about it. And even if you don't wax or shave your private parts, it's okay because it prevents other infections from entering your vagina. So I hope I've answered most of your queries of the common gynec problems. If you all have any more queries or if you would like to contact me, then you can reach me at Apollo Spectra Hospital, Tardeo. And my name is Dr. Tejal Soni, and it was nice to speak to you all. Thank you.